Other than getting a screening during our annual eye exam, many of us never think about glaucoma, a disease that damages the optic nerves and can lead to blindness. Here's a closer look in this week's Positively Healthy. The most common form of glaucoma affects more than 2 million Americans over age 40. It's likely many more have it but don't know it. One of the leading causes of blindness, people may have it for years with no indication.
And then they become symptomatic, unfortunately, but it's too late for us to do very much at that point.
It's why ophthalmologist Timothy Quinn stresses the importance of a thorough eye exam to look for this stealthy condition.
It's detected by several measures. First is a pressure check, which can be by air puff. Most are done with what's called Goldman applanation tonometry, which is the blue light test.
The common puff test checks the eye's resistance to a burst of air, which may indicate a problem.
It comes down to a problem with elevated pressure inside the eye that leads to damage to the wiring or the nerves that communicate the message of sight back to the brain.
A painless condition, glaucoma slowly steals a patient's sight.
When we talk about blindness due to macular degeneration, diabetic retinopathy, these kinds of things, it's usually some part of the vision that's lost. Whereas with glaucoma, it can actually go to blackness, where there's no sight at all.
The bright spot is that with early detection, doctors can successfully manage glaucoma by lowering the fluid in the eye that causes pressure to build.
We always start with drops. We have more medications than we had 15 years ago with fewer side effects, but medications work quite well, both at suppressing the fluid production and some increase the drainage.
Dr. Quinn also points to laser options and surgical treatments for advanced cases, including the tiny eye stent, which serves as a miniature drain.
It's the smallest human implant available today. It's about 1 millimeter long and about 1/3 of a millimeter wide.
Seeing the condition and its solutions should give glaucoma patients a measure of comfort.